Welcome back, dear viewers, to Voice of Africa, your #1 destination for reliable, hopeful, and impactful stories from our beloved continent. Today, we're excited, truly excited, to share a groundbreaking update from Burkina Faso that reflects not only a shift in public policy, but a deep, heartfelt commitment to the well-being of everyday people. In a time when economic pressures and global uncertainties continue to challenge many African nations, Burkina Faso has taken a bold and concrete step to ease the burden of healthcare costs for its citizens. Before we dive into today's in-depth report, let us remind everyone watching that this channel is committed to peace, development, and the honest reporting of facts. We do not encourage division, violence, or any act that could harm the stability of our nations. We believe in the power of unity, informed dialogue, and transformative policies, and we aim to spotlight those stories that often go unnoticed. Now, what exactly happened in Burkina Faso? On May 26, 2025, a pivotal meeting took place between the Minister of Health and various media professionals. During this encounter, the government unveiled a series of measures that directly tackle one of the most pressing issues faced by Burkinabe families: the high cost of health care. More specifically, they announced a significant reduction in the public sale prices of essential generic medicines, medical consumables, and even some vaccines. And this isn't a limited rollout. It applies across the entire national territory. This is not only historic, it's a lifeline for countless families. This new healthcare measure is a direct response to the vision and commitment of the President of Faso, who has made it clear that improving access to affordable healthcare is a national priority. For many citizens, even the most basic medications were becoming unaffordable. Imagine having to choose between buying antibiotics for your child or putting food on the table. That was the harsh reality for far too many. But with this new policy, the government is addressing that struggle head-on. Let's get into the numbers. The profit margin of district distribution depots, which are key links in the medical supply chain, has been reduced from 7.55% to 6%. That may sound like a minor tweak, but it's actually a huge shift in operational dynamics. Additionally, the average product margin has now been set at 4.31%. In simpler terms, if a district distribution depot places an order worth 1 million CFA francs with CAMEC, the Central Purchasing Office for Essential Generic Medicines, they'll now save about 300,000 CFA francs compared to previous pricing. That's 300,000 francs that can be redirected towards stocking more supplies, expanding services, or even reducing costs further down the line. Of course, reducing prices is only part of the equation. What's the use of cheaper medicine if it's not available when and where people need it? The government and CAMEC know this, and they're moving decisively to ensure that availability matches affordability. CAMEC, which plays a central role in Burkina Faso's healthcare system, is responsible for the procurement, storage, and distribution of pharmaceutical products. And right now, the agency is undergoing a significant operational transformation to boost its efficiency and responsiveness. The Director of Operations and Logistics at CAMEC recently confirmed that the organization is indeed in a dynamic phase of improvement. There is currently a visible strengthening in product availability across the board. One standout example relates to tracer products. These are high-priority medicines often used to monitor the effectiveness of healthcare delivery. As of the end of March 2024, the availability rate for these items was at 45%. Fast forward to the end of May 2025, and that figure had risen dramatically to 75%. The goal is to hit 90% by the end of June 2025, and all indicators suggest they're on track to do just that. This improvement isn't just about hitting numbers, it's about saving lives. With more medicine available in hospitals and health centers, more lives can be treated, more families can stay healthy, and more communities can thrive. And to meet this growing demand, supply chain operations are being scaled up impressively. Currently, Burkina Faso is receiving between 20 to 25 containers of medical supplies per week. That's a significant increase compared to previous months when the flow had noticeably slowed. This influx shows the level of priority that the health sector now holds in national planning. All incoming products are first received at a dedicated 2,000 square meter quarantine warehouse. Here, two critical steps take place before the medicines can be moved to central warehouses. First, there is a verification process to ensure that the deliveries match the original orders. Then, there's a stringent quality control process to make sure that what's being sent out to hospitals and clinics is safe, effective, and reliable. This attention to detail is not just admirable, it's essential. From the central warehouses, the products are then dispatched to regional commercial agencies like WAGA 1, which serves the public sector. WAGA 1 plays a key role in daily healthcare delivery, supplying medicines to health districts and public hospitals. The process is streamlined but meticulous. Local agencies submit their orders based on specific needs. The central warehouse processes these requests, prepares the packages, and organizes timely deliveries. The flow of goods at these regional hubs is fast and dynamic, demanding both strategic reorganization of tasks and enhanced security protocols. Let's take a brief moment here to say thank you. To our loyal subscribers, members, and supporters, your engagement means the world to us. Because of your shares, your likes, your comments, and your generous support through Super Thanks, we are able to continue bringing these essential stories to light. If you haven't already subscribed, now is a perfect time. If you find value in our work and want to see more in-depth reporting from across Africa, consider supporting us with a Super Thanks. Every contribution helps us go further, dig deeper, and amplify the stories that matter most. Now, back to the pulse of the story. Beyond logistics, this initiative represents a massive policy shift. By directly reducing profit margins and streamlining operations, the government is showing a level of responsiveness that deserves recognition. This is not just about medicine. It's about prioritizing human dignity. It's about recognizing that health is not a luxury. It's a right. And in a region where access to health care has historically been inequitable, this move by Burkina Faso could serve as a model for other nations facing similar challenges. Let's also acknowledge the people behind the scenes, the warehouse workers who unload container after container, the pharmacists who double-check every batch, the logistics teams who plan each shipment route, and the ministry staff who work tirelessly to push this policy forward. This achievement is the result of teamwork, foresight, and above all, a sense of responsibility to the public. The implications of this policy extend well beyond Burkina Faso. Across Africa, nations are wrestling with the twin challenges of health access and affordability. If Burkina Faso can successfully reduce prices, increase stock, and ensure distribution, it opens the door for regional collaboration. It sparks the possibility of joint purchasing agreements, shared logistics hubs, and even a continental approach to pharmaceutical self-reliance. Especially in a post-pandemic world where global supply chains remain fragile, this kind of regional self-sufficiency is not just strategic, it's essential. Moreover, the transparency with which these changes are being implemented is notable. By inviting media professionals to the May 26th briefing and maintaining open communication, the government is signaling its accountability to the public. This level of openness helps build trust, a precious commodity in any democracy, and sets a precedent for how policy reforms should be communicated and monitored. As we reflect on this milestone, let's also recognize that the journey is far from over. While 75% availability is a huge leap from 45%, the target is still 90%, and the ultimate goal should be 100%. Challenges remain, whether in last-mile delivery, maintenance of cold chains for vaccines, or ensuring that rural clinics are not left out. But the momentum is strong, and the political will is evident. At Voice of Africa, we will continue to follow this story. We will keep you updated on the progress, and we will not hesitate to ask the hard questions when needed. Because that's what our communities deserve: truth, clarity, and unwavering attention to the policies that shape their daily lives. So, as we close today's report, let's hold on to this sense of hope. Let's celebrate the progress, acknowledge the work ahead, and continue to push for a future where every African has access to the care they need, not just in Burkina Faso, but in every corner of the continent. And remember, the more we share stories like these, the more we shape a positive, empowered narrative for Africa. By Africans, for Africans, and with Africans. Thank you once again for watching Voice of Africa. Stay tuned, stay informed,